in my opinion, the way I think about this is HIPAA is being violated basically at every
Yeah.
instance. It's just that in the human brain instead of the AI brain.
Welcome to AI for Pharma Growth, the podcast from pioneering pharma artificial intelligence entrepreneur Dr. Andree Bates. This show aims to demystify AI for all those in biopharma, from startup biotech right through to big pharma. Each episode focuses on all things AI and future tech related to help pharma execs to navigate through and benefit from the sometimes confusing but magical world of AI-powered tools to grow and get real-world results.
Today's episode is From Population Models to Personal Intelligence, Rethinking Biological Data. For most of modern medicine's history, biological data has been a numbers game. Genomes and clinical histories pooled into population-scale datasets, mined for averages, and used to predict what people like you might experience, rather than what you actually will. The individual in this model is a statistical contributor, a row in a spreadsheet. But a quiet shift is underway. As cryptography, biometrics, and secure computation mature in parallel, a new generation of builders is asking a more radical question. What if your biology wasn't an entry in a database, but a sovereign record only you could unlock? One that could prove at the moment of every query that you were present and consenting. In this conversation, the founders behind one of the more provocative attempts to answer that question discuss why the population model has run its course and why the future of biological data may have less to do with bigger data sets and more to do with smaller, stronger guarantees. So today we're sitting down with Ken Clark, who's the co-founder and CEO of Enigma Genetics, to discuss this. Ken has spent his career on one problem, finding the infrastructure failure underneath an expensive recurring dysfunction and building the system that makes it structurally impossible. He has run organizations at scale, led transformations that eliminated millions in redundant process, and built governed platforms that replaced fragmented institution by institution workflows with unified systems. Welcome to the show, Ken.
Thank you. It's great to
Let's
be here.
start. It's so good to have you. I'm so excited. There's such an interesting area that things are getting into now with you guys. Let's start with you telling us a little bit more about your background and what led you to co-found Enigma Genetics.
Yeah, so I'm an engineer by trade, and I'm a systems thinker who's really curious about biology, and I really found myself at a crux when I found myself at a personal, you know, medical emergency essentially. So I had a shoulder injury that I had three subsequent surgeries on,
Yeah.
and I developed COVID-19, and so the fourth surgery was scheduled, and once I went in for that fourth surgery, it was like a light switch in my biology. It was very obvious that something had changed, and over the next year and a half, I underwent two subsequent surgeries that were essentially
Mhm.
just really trying to defeat this infection that had persisted, since this fourth surgery.
Mm.
And when I was really trying to understand it, it seemed really logic to look, at the data. And when
Mhm.
I went to interrogate, the medical establishment, there was really nothing there to be learned.
Mhm.
And I started to theorize, if I was to be able to understand what had happened in my identity and in my biology, what would that take and what would it look like?
Mm.
And um, I really came to this pivotal moment that I realized that everything that needed to be understood was at the individual level, and it
Mm.
wasn't, and unless I had my own, I guess I call it a reversion. I'm a software engineer by trade, so that's how I really
Yeah.
think about this. Is if I had
Yeah.
a previous state that I could compare against, then I could really make some intelligent decisions there.
Yes, I like that idea, that analogy.
So it's a really basic way to look at this. But as I kind of moved through the system and educated myself really in this field, I understood that my theory was essentially correct and possible, and there wasn't really a scientific limitation. It was more about economics, and I guess from that point, I really started to think, if this was to be useful, and I was to be able to track those changes in my lifetime, how valuable would it be, um,
Yeah.
to be understand those errors as they accumulated over a lifetime, and then potentially flipping the script of how we think about this. And big pharma really tries to overlay all the anomalous data and
Mm.
find these correlations among populations, where I believe we don't have the computational power to understand necessarily these errors at the individual variable level, but we don't
Mm.
have to if we have a good working copy of what a healthy version of ourselves look like. So that's the basis of all of this, is creating basically a healthy version of
Yeah.
ourselves so that as science progresses in the future, we can revert and at least compare those 2 models and to really interrogate and understand, ourselves a little better.
I love that. It's reminding me of digital twins as well,
Yeah, it's
and
very
where
similar,
things,
and
yeah,
yes, it's interesting because I started, really just thinking about this at a genetics level, and then I really came to understand that the more data sets that you can overlay, the more comprehensive the picture and the
yeah,
more understanding we can draw from them. And then, really as you inject AI into the situation, my real dream and what we've come to build is an AI that lives within your personal profile. And it's literally working day and night trying to aggregate the most comprehensive state for you and your doctor to understand, So whether it's
amazing.
taking your wearables, your actual genetic information, your medical records, your images, it's trying to it's trying to culminate that into the most comprehensive version of yourself. Not so much so that you yourself can make determinations or can make predictions or give you directives. It's more about giving your doctor the most comprehensive set of information to make his diagnosis.
Yeah. And it makes so much sense when you think about clinical trials and how, for any drug, there's only subsegments of people with that condition that it works for.
Yeah.
And, people are always looking for, pharma are always looking for what's the right subsection of patients to use this on. But it's so true that everyone is so different and there's so much individual variation in bodies.
Yeah, so I think I listened to one of your podcasts about the clinical trials, and I think it's really important to not only working on the pharma side, but work at the individual level and having those
Yeah.
two agents that are really working in synergy to find the most opportune mechanism for your healthcare.
Yeah. It's interesting because pharma has spent well over a decade now talking about precision medicine. So, from your vantage point, has the industry delivered on that at all, or is it still rebranded population thinking, but with slightly better tweaks?
Yeah, I think that there's some real limitations when you talk about identity and,
Mm.
HIPAA, and I think that those things are so antiquated and outdated in the way that they're thinking about these things. And there's a lot of technology, especially when we talk about, you know, post-quantum capabilities,
Mm.
to rethink and really replot this landscape as far as how we're interacting entity-wise. And I think at the
Mm.
heart of this, it really is important that we place the individual at the helm of the ship. And
Yeah.
if we can be transparent about what data is being exchanged, who the actors are, and for what purpose, and then having
Yeah.
that having that as a living document that they can essentially log in and see who's accessing at any given point and revoke that access. You
Yeah.
know, I think
Yeah.
that if we can do that in a way that allows a authorization that is rooted at the individual,
Yeah.
we can allow them to have access to things and access to information by way of request. And that's really what
Yeah.
we're trying to do is we're saying this
Yeah.
person has this disease. All of a sudden, there's this new pharmaceutical drug, but there's no real mechanism for that new information to reach that individual. And, there's all of these very inefficient processes that are in place. And
Yeah.
it seems to us that if we could just issue a notification giving them all of the terms in a transparent way and then allowing that basically communication to happen on the platform without any personal or medical information being exchanged and just showing this, you know, X
Yeah.
user, you know, is
Yeah.
available. Here you go. And making that
Yeah.
connection so that that can happen without all of these redundant kind of, there in my opinion, the way I think about this is, HIPAA is being violated basically at
Oh,
every
yeah.
instance. It's just that in the human brain instead of the AI brain. If history tell us anything, it's that humans are inherently corrupt, you know, and so I think that if we can really build these strong controls around how our AI is handling our information, and then have that in an audible way, we can really move this ahead leaps and bounds in a very short amount of time.
I totally agree. And it is something that a lot of different patient groups have been trying to do in a different way. I was working with a group that was cystic fibrosis, and they wanted to do that. They said, we want to give our data to pharma for trials and things, but we want it to be that we make the decision on a case by case basis and we can revoke that decision. So they started looking at blockchain for things like that. But I think that model is really sensible and really, we've got GDPR in Europe, but being able to revoke that access is a big part as well that I feel like is being not, you know, it is amazing. I was at something in Germany, I think it was about 2 years ago, and there were just different pharma people there. And there was a guy from China and a guy from Germany talking about, this is just a conversation over a drink, but talking about data and health record data. And the German guy said, we just can't get access to this data. It's just not, I mean, in America, you do have access, but less access in Europe. And the Chinese guy said, what? What do you mean? I've got access to German healthcare data.
Right.
And then he said, do you want, I can look up your medical record on my phone. And he said, okay, let's test it. And he had it. So,
Mm.
it's very
There's a lot to be said
equitable
for that.
how people access it at the moment.
I think that there's a lot to be said for that, and really recognizing where we are in time
Mm,
and space, and not turning a blind eye to those kinds of things. It
yeah.
seems to me that it makes no sense to create a regulatory nest or a bee's nest that essentially no one can navigate. Meanwhile, China is
Yeah. It's true.
harvesting all of our information, whether they can decrypt it now or not. And I think
Mm,
that there really needs to be a awareness brought into this space about post quantum computation and the inherent risks thereof. And I think that the cliff is moving up faster and faster, and
yeah.
it seems like, especially in the medical space, there's no real movement until there's a push, and whether it's a breach or something that's
Mm,
ethically comes to the surface that drives these changes. And I think that
yeah.
That's something that we've really thought a lot about at Enigma, and we're trying to do things the way they should be done from the beginning,
Mm.
you
Yeah,
know? So
it's nice.
when we talk about going back to really the individual, we really found that the biggest key to this is tying it back to an individual identity, and it
Mm.
seems that you know, I personally have experienced this where, even locally, there's 3 different hospital, organizations and 3 different apps, and it's a manual, transfer on it's all on my behalf to
Yeah,
exchange that information, and there's some real ethical,
yeah,
shortcomings there, right? I mean, it seems to me
totally.
that extreme. It's a real injustice that we can't find a uniform way to exchange this information, and especially
Yeah,
when it comes to our patients and their lives.
yeah, and having that ethical basis that you can then not just give if it's your data is has been given in one place um, that you can't say, "No, I don't want it to be given to this one. I only want it to this one," for example.
Yes. Yeah. And so what we've really thought about is, you know, in the best case scenario, if this was done the most ethically way possible, we would give that data back to the individual.
Yeah,
And we would allow them not only to be in control of it, but house it and maintain it.
yeah.
And it seems that the only thing that could really or should be controlled is the access to that information.
Mm, yeah,
And that's where we really are thinking about flipping the script and creating this environment where the liability no longer is on the institution, the hospital, right, to house
yeah,
and maintain this genetic information forever, right?
yeah.
Whether I'm in hospital A or hospital B, hospital A still has to maintain my data, regardless
Mm,
if I'm completely, geographically relocated, it doesn't matter. And so
yeah,
we think that there should be a process for offloading that information, giving it back to that individual, and then
yeah,
just merely charging access fees, right?
yeah,
Whether it's I'm in the model that we've really built is on a commit basis. So, when we think about going back to software in my mind, how I think about things, you know, um, thinking about really a GitHub for your biology and just every instance, whether it's you know, um, a form, an entire genetic sequence, or just a questionnaire, it all be committed onto one single longitudinal line that could, and when in our app, it's essentially just a timeline that you can scroll and,
yeah,
most current all the way back. And within that is that AI that's working day and night to create the most comprehensive state,
yeah.
with what's update information.
What data do you put in there?
So we're working to really be able to ingest any kind of medical information.
Mm,
Obviously, the most complex being an entire genome sequence, which we are
mm,
we are able to do, but also
mm,
image analysis. One of the
yeah,
things that we really uncovered, not being a part of this, is the formatting incompatibilities just from one institution to another,
yeah,
and the archaic
yeah,
way of getting a CD and carrying that around and giving it to the next institution so they could just review the image. And just
yeah,
something as simple as that, and being able to tackle that, so
yeah,
that whatever institution I go to, I can convert that image to whatever format they need it to be in so that they
yeah,
can understand it and make a determination, because that's ultimately what we're trying to do is make educated decisions, and get smarter.
yeah. Have you talked to people in pharma and clinicians and patients about this? And are there any groups that are meaningfully ahead of the others in how they're thinking about individual biology?
So, that's really been our biggest roadblock is access. And, we found that, this is such a closed, a closed environment that it's really hard to break. And like I was saying before, the status quo is so much easier than, bringing
Yeah.
in some, even a slight change in any of the workflows,
Yeah.
creates some real, ripple effects. And there's a lot of hesitation, especially, when we talk about data. So
Yeah.
that's what we're working on right now, is finding partners that are willing to, try this out, right? So
Yeah.
we've developed, ROI ROIs for several use cases. Obviously, clinical trials is the highest return for
Mm.
investment. But with rare disease patients being the highest value data sets.
Yeah. I think that's so interesting. I have got an idea of a pharma company that may be interested. I can talk to you later about.
Yeah,
Um, so, there's standard reference ranges in these population models for blood tests and hormone panels and genetic risk scores. Where do they fall fundamentally short with the individual?
I think it's very obvious. When you look at clinical trials is a great example of how
Mm.
these things fall short, right? So as
Yeah.
we model our best case scenario, often when we run those models on actual populations, we get entirely different outcomes. And I
Yeah.
think that's a testament to just how when we apply, I guess, population level analysis to an individual, we inherently miss. Um, I think I would say the majority, and the real the real the real roadblock that I see right now is the computational power to actually make those determinations.
Uh, how are you doing that now? Are you using supercomputers or what are you doing?
So I don't really want to get into exactly how we're doing it. That's one of
Okay.
our secret
Secret
sauces.
sources? Yeah.
Y- yes, but our models are we are able to do it with a model that's approximately 1% of what some of our competitors are doing based on our analysis. And
Uh,
that's based on using this idea of an individual AI that starts basically at time zero when you start. And so we're not
yeah.
trying to understand past information.
Yeah.
I listened to one of the more recent podcasts where you were talking about how some companies are really spending a lot of time trying to curate this information and going in and making something out of what they have. And
Mm.
I think that we need to draw a line in the sand and really
Mm.
and just start with new data. I think
Yeah.
that the more bad data you bring into the situation,
The worse the output. Garbage in,
and
garbage out.
the higher the liability, and the more
Mm.
time need to be spent working on those models. Where
Yeah.
if we can audit, and we have we have a system in which we're evaluating the individual and then only going out and getting relevant information and pulling it back into that AI,
Yeah.
we've we've had accuracy in the 99.9% 9 percentile with actual, diagnosis versus, a doctor's diagnosis,
Yeah.
and comparing those. So we're getting really confident that our model is at least as good as, that doctor.
Yeah.
It's about time and building that trust so that not only the individual believes that the AI can make that determination, but the establishment and the other doctors can also
Mm.
acknowledge that, and I think that that's the biggest thing that we have to overcome is the trust not only in the system, but in really the technology,
Yeah.
and then building safeguards and,
Yes.
that are truly auditing it and then comparing it against, and I think that we need to be open to, errors, right? So
Mm.
if we think about, and use the example of self-driving cars,
Mm.
compared to the safety of a human-driven car. It's not even apples to apples.
Mm.
A uh, AI-driven car is 100 times more safe, but you don't hear about that in the news, and it's not really what's in the perception. When
Yeah,
one
considering how
human
many human
dies.
accidents there
Right.
are.
And so
Yeah.
we need to really, bring that into perspective. And I think that there should be some tolerance, for making this better. And I,
Yeah.
I think we shouldn't, be so binary in our thinking because will, I can see, um, single use cases or single instances, having industry-wide effects, and
Yeah.
if it's not done correctly, and that's why we've set out to do this in a way that is, ethical from the start so that, maybe it's incredible watching all of these AI health, agents. It
Yeah.
Over the last week, they've just been popping up everywhere,
Yeah.
but I don't really, that doesn't get me too excited because I truly believe that there's a difference between doing something and doing something right. And
Yeah.
and when I look at it, just looking at their user agreements
Mhm.
and what they're saying that they're doing it for, and the
Yeah.
reasons behind it, it's about authentication and verification of the user. It should be about the health of the user and making the user, a better life
Yeah.
and healthier outcomes, and so I think that if we really start thinking about that and not protecting ourselves,
Mm.
we can incrementally, get towards where we wanna go.
One other thing that I was just thinking is, real world evidence is the buzzword of the decade in pharma. How does individual level consented verifiable data change what real world evidence could actually deliver to a pharma company who's developing a drug?
Well, I think when you have a consent engine that has the ability to persist beyond clinical trials, you have the
Mm.
opportunity to re-engage that patient beyond the scope of that original clinical trial, and I think that
Yeah.
it also gives us the opportunity to share that information, and built into the way clinical trials are structured, the information is siloed and
Yeah.
so and it really can't be accessed, so there's a lot of opportunities, that is in really a more non-competitive space than, say big pharma, that there's an opportunity for multiple parties to glean information from any given data set. So I
Yeah.
think that as we create, an environment where we allow the individual to essentially consent to those things, and then a big part of this is also making them a beneficiary of those successes.
Yeah.
We've talked a lot about making, um, really that the clinical trial experience, much more beneficiary from the individual, perspective, without incentivizing, the structure of the clinical
Mm.
trial. And I think that there's a lot to be improved upon in that space, and I think there could be a lot of efficiencies gained just by even having I guess assigning a value to any given disease or
Yeah.
a data set type, so that the rare disease, it's inherently built in so that we're not kind of escalating based on our inability to find this participant and willing to give more and more to basically find them as our deadlines are approaching. Um,
Yeah.
what if there was no inefficiencies there? We could literally just send them a consent, and then they were able to be a beneficiary of all that inefficiency.
Yeah.
And that's really what we're really trying to do is completely reshape and rethink the way that we're doing this so that one, we're not wasting time and money, but we're also creating meaningful change in a short amount of time.
And say we look forward 10 years, what does this work that you guys are doing, how does that change things for the average person as well as a pharma company in terms of their pipeline and their trials, clinical trials and their commercial model? Is there any kind of thoughts you've got on, if they've fully all humans and the big pharma have embraced this model, your model, what would change for each of those?
Yeah, so my hope is that in the not so distant future that we can start moving towards individualized therapies and potentially
Mm,
we'll call them genetic reversions that aren't necessarily understood as to what had changed or I guess why the change happened.
yeah,
Just knowing that the previous reversion or version was a healthier state and being
mm,
able to create um, a, a new category of really biological economy that individualized therapies can start to be engineered.
yeah,
And so that I imagine this pool of engineers that are essentially they take your data set. We know what needs to be changed, and they're working on engineering that delivery system that essentially is utilizing CRISPR. And I'm sure we'll have even more advanced technologies in the future that can maybe individual at the individual level actually make those edits. Just to add to that, I
mm,
think that going back to this kind of longitudinal tracker as we make in the future as we make those edits, it's going to be very important to have a system that can track those changes over time
mm,
and
yeah,
and and verify that that change has remained and and then really understand that at a individual level that you imagine a clinical trial for an individual.
mm. I love this. I love that whole I love it when different disciplines kind of cross over, and I love that concept of, you know, rebooting the computer back to, you know, the last stage when you didn't have a bug or something, and doing
Exactly.
that with humans. It's so
I
cool.
don't I don't need to know, what broke last night when you were coding, Jimmy. All I need to know is that yesterday it worked. Put it back
Yeah,
to that version
exactly.
and we can work on that tonight, right?
It's
So and
so
that
cool.
that's really I think it's possible.
Mm, yeah,
It's probably probable that this will happen in the future. It's just a matter of
yeah,
who does it and they do it in a way that is actually
different.
helpful to humanity.
Yeah, exactly. No, I love that. Such a cool. Really enjoyed this conversation. I'm sure that there will be people listening that would be curious to get to know more. Where could they find you? And what's the first step for someone who really wants to move beyond population model thinking and start understanding this more deeply?
Yeah, so I think, start feeding the data set is the most
Mm,
important thing.
mm,
Start building your own comprehensive model so that you could be reverted in the future. So
yeah.
we're building our own AI model that is working to do that. We call it OmniMind. You can find that at enigmagenetics.cloud. And then,
Mm.
also just reach out to me at a personal level at Clark at Enigma Genetics, and I'd be happy to, continue this conversation with whomever wants to have it.
Fantastic. Well, thank you so much for your time. Such a fascinating field that you're now in, even though you may not have thought that's where you were going to end up, and really enjoyed it. So thank you so much. I'm really curious to see where you go.
No, the pleasure's all mine. Thank you so much, and I'm excited about where this goes. I think that if we try to predict where we're going, we'll never get there.
Yeah,
Let's start moving towards a better
see.
tomorrow. Figure out what that looks like on our way.
Thanks for listening to this episode of AI for Farmer Growth. If you have received huge value from this show, or maybe this episode has highlighted how you can use AI in your company, then we would love for you to support the show by leaving us a 5-star rating. Please make sure you hit the subscribe or follow button on your podcast app now to make sure you never miss an episode.